Thank you for having me today. This is a system I'm developing together with many colleagues here at Hong Kong U. The idea is to keep the COVID-19 pandemic from overwhelming the healthcare systems. Half the world remained at home. However, the world could not remain at home forever. The economic costs are simply too high. To prevent a future epidemic wave from growing exponentially, manual contact tracing will not work. It is simply too slow. Contact tracing needs to be instantaneous because the number of transmissions per day significantly increases after day 2. Google and Apple privacy-preserving contact tracing is instantaneous, but it uses the Bluetooth Receive Signal Strength Indicator, the RSSI value, to determine the distance for the exposure risk level. RSSI measurements are not a reliable way to calculate distances because they fluctuate greatly under different conditions. And this uncertainty is inherent to all wireless signals. Although transmission risk for COVID-19 is commonly measured in terms of distances, for instance, to remain 2 meters apart, it is difficult to determine the two phones pictured below are 2 meters apart or 8 meters. Therefore, Google and Apple contact tracing lacks the necessary spatial context required to calculate the exposure risk level accurately, potentially leading to many missed detections. Outdoors, where the risk of transmission from COVID-19 is less, Bluetooth RSSI values make people appear much closer than they are because there are fewer obstacles and fewer bodies to absorb the radio signal. Indoors, where the transmission risk from COVID-19 is greater, Bluetooth RSSI values make people appear further apart because furniture and people's bodies absorb the radio signals. Adding a static Bluetooth device, which participates in Google and Apple contact tracing, to a room allows for spatial contact tracing. Mounted on the ceiling of the room, the device will receive the RSSI value more clearly. Additionally, people who attend an event but do not have the app installed can be notified by the spatial contact tracing system. Data collected through the spatial contact tracing could also be used by epidemiologists for redefining transmission models and hence refine both the conditions that trigger contact tracing user alerts and how severe those alerts actually are. A building with multiple static devices and a manager who has a comprehensive view of the severity of contact between positive testing traces in the building could send different levels of warning. For example, one notification for recipients within the same room as the positive testing user, another notification for recipients occupying the same floor, and a third notification for recipients occupying the same building. Alerted contacts could then decide on their relevant level of response to take, which is essentially pertinent to those with pre-existing health conditions or for contacts who live with or frequently visit individuals at higher risk. Spatial contact tracing will significantly increase the number of people notified instantly when a COVID-19 case is confirmed. In the diagram of trace contacts below, each icon represents one case in Singapore. A cluster of cases often occurred at a single location, such as the preschool in the figure below. But when a sudden exponential rise in cases overwhelmed the people manually tracing the contacts, they could no longer identify all the contacts within the crucial 2-day window, and details of the cases were not recorded. Hundreds of cases were then not adequately traced. The Google and Apple system only traces device to device, phone to phone proximity, and will therefore have a limited impact. Spatial contact tracing maintains the location and identity privacy of the app users while adding spatial and temporal awareness to the system. Following Google and Apple specifications, the low-cost US $25 spatial contacting tracing device inherits the security and privacy features of Google and Apple contact tracing system. Since only the managers of the spaces with these devices have knowledge of the device's locations, the spatial contact tracing system is decentralized and privacy preserving. For users who do not own a mobile device, using a US $12 Bluetooth beacon with ephemeral identifiers, which is a unique rolling ID system that helps preserve privacy, allows such users to receive exposure notifications. These users could then choose when and where to carry the beacon, further preserving their privacy. Spatial contact tracing significantly extends the effectiveness of the Google and Apple contact tracing system through low-cost devices, protecting billions of people, whether or not they have an Apple or Android mobile phone. Similar to visual fire systems that are required in public buildings, these are systems that are installed for the very few instances that will eventually save lives. In the space of the past 2 decades, we have seen infectious outbreaks of SARS, H1N1, MERS, Ebola, and now COVID-19. In response to these contemporary crises, 4 of which played out in modern cities filled with modern technology, we ask, how should cities be defended against infectious disease? Thank you.